are men with chronic UTI harder to treat than women? And if so, is it due to the possibility of the infection making its way to the prostate?
Okay. In our approach to men, that I was explaining this the other day, that the male urogenital anatomy involves a whole lot of tubes that connect to each other. So you've got the urethra, you've got the seminal ducts, you've got the prostate, and then you've got the seminal vesicles and so on and so forth, the tubes all around. Now, to us humans, it looks like, it's beautifully defined, but to a microbe swimming around, as far as they're concerned, they're just swimming in a lake, and it's they don't give a toss where it is. So I think that there again, it comes, you've got to be awfully careful about trying to compartmentalize it. I think that there are conditions where certain organs manifest more symptoms and so on and so forth, but in most of the men that we're handling, we see this. I prefer to call a urogenital infection. Others call it prostatitis, urethritis, prostatinia, what have you. And we're starting to accumulate a large number of these men coming through, and they suffer. I think that the thing that the penile pains are horrible, and that penile tip pain is really, really horrible for them. And the other thing is that the trial and error elimination practice has crystallized, and they're clustering with the macrolides and tetracyclines, and 50% of them are ending up on a combination of macrolide and tetracycline. And there was an Irish man who provided me his graph for the book, which shows that terribly long journey. Now he's influenced us in the sense, when we saw that, we realized we needed a much more sensitive symptom score, because he did brilliantly the way he plotted it all out. And it comes back to the fact it takes ages. And you just got to keep sticking there. And from time to time that we will, we lose confidence, they lose confidence, and we stop treatment for a trial without treatment. And boy, it usually declares that it needs it. Yeah. So they've got some pretty specific symptoms. And the other thing that's often, they get awful pain after ejaculation, they get pain during defecation, these things, and then this penile tip pain, which can be absolute bloody agony, and you just got to keep going on and on and on, and understand that neuropathic pain is going to be a component of this, that there are the people are sitting there waiting, a slam dunk for a C fiber neuropathy. So and the only way of dealing with C fiber neuropathies is to treat the underlying cause and get rid of it.